involvement, why it needs to be a part of your research, study or trial is our presentation today. I'm going to be co-presenting with the excellent Tracy Ibbotson standing here beside me. And then Steph Allen, my colleague from Psychosis Research Group, is going to join us for the panel section. The way we hope this goes, and Steph, could you keep an eye on time for me, please, is that we will do presentations and possibly include a video as well that will last about 40 minutes, then giving 20 minutes for your questions. Just to say at the beginning, I'm from mental health and wellbeing, as is Tracy, as is Steph. We are aware this is a School of Health and Wellbeing presentation. So if you'll forgive our kind of more niche knowledge, it can be extrapolated and applied across whatever health subject or discipline you're working in. Okay, so first of all, some introductions. This is me at the top, kind of a thinner pre-COVID version of me, actually, that I'm hoping to get back to, but time will tell. I've put my email address, the first name in red, because it's my Sunday name that is used for my work email. So please be aware of that if you do want to get in touch. Next up is Tracy. Do you want to introduce yourself, Tracy?
Yes, I'm actually based in general practice.
Oh, I'm so sorry.
No problem. I quite like to work in mental health. And yeah, so I'm level 3 here, the same building. Yeah. And yeah, I have 2 roles. One is for the college and the other one is for NHS Research Scotland's Primary Care Network. And both of those roles I kind of do PPI work for them.
Okay, and Steph's given us a picture that demonstrates she's a lot more friends than either Tracy or I appear to, my profile picture, which is fine. She's a lovely person, so I'm all cool with that. And Steph is a colleague of mine in the Psychosis Research Group, as I mentioned. She's currently awaiting PhD Viva, which isn't at all nerve-wracking, I'm sure, and has just applied for her first grant. And is very familiar with PPI, which is why I asked her to come along today, as she will have a lot to share and also help us answer your questions as fully as we can. Okay, so let's just start then. The first slide, is that working? That would be, yeah. Oh, there we go, hang on. Oh, you've got the computer. Tracy's just in control here. So what is PPI? PPIE, you might also see it listed as PPIE. It is patient and public involvement, or patient and public involvement and engagement. Very simply, why do you want to know about it? You want to know about it because, first of all, it will really benefit your research trial in lots of ways, around recruitment, around conduct, around dissemination, around planning, in fact, around every aspect. And I'll talk a bit more about that later. How does it work? Again, that's something we're going to cover today. I've got a slide later to cover that too. And then we're going to finish up today with where you can go to find out more. And Tracy will speak later too about funding applications and things like that too, as well. Sorry, I'm having technical issues. Incompetence. Oh, okay, gotcha. So what is PPI? Let's start there. These are some very basic definitions. Public involvement in research means that research that is done with or by the public. It is not to, about, or for them. They are not participants. They are experts that are consulted and involved in your research to help enhance it. In the same way that if a pipe burst in my house, I probably would not try and fix it. Gaffer tape probably wouldn't do the job. So I would call a plumber. And in the same way, we see our experts by experience or lived experience, service users, or there's a whole gamut of names and words used, but recognizing, respecting, and involving their expertise is exactly what we want to be doing in research. And why? So, lots of reasons, as you can see here. We want to make sure that we're recruiting and hitting our recruitment targets for a good outcome, and making sure that whatever results we have, they are validated by our recruitment targets. So that means not just recruiting participants, but retaining them as well. And finding out what barriers there might be to either of those things is a terrific way that PPI members can be involved. in pointing out things that you or I may never have considered just because we're not living with the conditions that those people are and the inherent difficulties that can come with that. We also want to make sure that any communications that we are sending out are not only clear, understandable, and easily accessible, but also they're not accidentally alarming or cause problems or worries or concerns for our participants. Sometimes that can be the case, and especially in cultures where there's a copy and paste kind of style of taking from a previous information sheet and then just copy and pasting that to our next one. And the reason that can cause problems is Scotland has a relatively small population of whatever participant group it is that you're sampling. So unintentionally alienating potential participants is really something we all want to avoid, both for our current research and research in the future. So as you can see here, I'm not going to go through everything because we are time pressed, but the big one at the end is that funders now require it. And it's to your advantage, not just for your funding applications potential of success, but genuinely for how well your trial will run and the outcomes that you will get from it. You can be more certain that those outcomes are legitimate because of the involvement of people with experience across your trial. Okay. Oh, look, I did things. Okay, so where do you want to go and look for stuff? Well, the NIHR has a fantastic website. I'm employed by the Scottish Mental Health Research Network, and we're just currently writing our new PPI strategy, which will be based on NIHR principles of meaningful PPI. And the first principle there, these are very simple. On the website, they go into a lot more detail. Please go check it out, but just to cover the 4 basic principles. One, involving the right people. So people that have information and expertise in the area or the diagnosis or the symptom bracket that you're exploring. Principle 2, involve enough people. Having 1 or 2 PPI members isn't really PPI. You want to have diversity as much as possible, as we seek in it in most things now, to have representation of as wide an experienced group as possible. And that's not for token reasons or because it's politically correct to do so. It's because the wider and broader experience base your PPI group has, the greater the chances of them being able to attend to any issues you're having on a trial or make suggestions that will impact and meet the needs of your participant group. So think about it. If you're recruiting, say, 90 participants and you only have 1 lived experience PPI member, how is that 1 experienced PPI member really meant to advise you that's going in a way that is effective for 90 people with a similar condition? It's not really a reasonable thing to do. It also, you need to take into account as well that people who are involved in PPI who have any kind of health condition can become unwell. And may come in the PPI group or may step back. So ensuring you have enough people covers that and allows you to be accommodating and supportive of your group. Oops, last 2 came in a bit of a rush. So you want to involve them enough. Obviously, we're trying to step away from any kind of token PPI groups where it's like, oh yeah, I've got PPI groups, so I'm sorted, but actually I'm making all the decisions. So we want to make sure that they are involved meaningfully. And that means planning your PPI in advance, making sure you have the funding for it, that you have the resources for it, and that includes staff as well. And then also you want to describe how it helps. I want to talk about this and share your PPI to demonstrate how it underpins your research. How am I doing time-wise? Okay. So here is breakdown of a randomized control trial and all the stages within. I'm not going to ask you to answer this cold, so don't worry, but have a think for a moment about what areas of that PPI members could be involved in a way that might benefit that stage. I'm just going to pause for 10, 15 seconds while you have a think about that. Okay, so the answer is every stage. Now, as you can see with the apply for fund and receive funding box, that's probably where many of you may first have thought about PPI and what to do with it, how to fill that box in, and how to make that work for you and for your PPI members in a way that is beneficial for both parties. Tracy's going to talk a bit more about that later. But something I want to raise right now is that, this area, even before you've written your research proposal, before you've applied for funding, is an excellent time to be consulting a PPI group. Now, clearly, this won't be your study PPI group as you haven't created that yet. But I would encourage you to go and engage with any other relevant to your field PPI groups out there. You can find them via support groups and see, I'm very familiar with mental health groups, but without that it's not really my territory, but they are out there. And the reason that it's really important to do that is to make sure that you might have come up with a terrific idea, but is it relevant to your participant group? Is it something that they actually care about or think will help, or is it a question for a question's sake? There is a limited amount of funding out there. So it's in your interest as a researcher, but also in the interest of the people who may benefit from an outcome or an intervention that you find within your study. That intervention or impact is going to benefit your participant group in a way that is meaningful and that can be implemented in a way that's straightforward and simple. So, next. So, where to begin, what to consider? Where could your trial or study benefit from input? We just talked about that. What else do you need to factor in? Where Tracy's going to tell you a bit more about that. Where to find your PPI members. Start looking now before you even have come up with an idea for a trial. Getting familiar with PPI groups, visiting them, interacting with them will improve your recruitment of PPI members and your reputation as somebody who cares about them when you need to recruit them for a trial. So can you get advice on how to do all of this stuff? Well, this presentation, I hope, is a starting point for that. I'm going to include some names of places in a minute. And the last thing is, what is a peer researcher, which is my job. And it's different from PPI in that I'm employed by the Scottish Mental Health Research Network to work within studies. So I kind of parachute into studies. I'm paid and I work across a trial, trying where I can to help and assist the running of that trial. So, and I should add, I'm a person that has significant and a lived experience as well as being a experienced researcher. So putting both those hats on at the same time is what lends my expertise in this role. Tracy, thank you for adding the links. You absolute legend. So these are all here now. Again, very conscious that we are kind of mental health focused, aside from Tracy, obviously, who's not. Thank you for correcting me on that. But hopefully these links will prove themselves a starting point for where you might begin to find your PPI members. And again, just to say before I hand over, are we doing time-wise?
Just when, I'm not sure when you start.
Okay, it's 25 cool, great. Yes, sorry. What I want to say is please go out there and try and get familiar with and engage with and find out about PPI groups before you need them, because that will be to your advantage. And it will mean that you're involving people in a way that is, as I said before, beneficial to you, but also, and importantly, beneficial to your PPI group as well.
So I did have a video about some of the groups that are on in the University of Glasgow, but I think I can send that round to people.
It's a great video and it's worth watching.
Yeah, but we're a bit short time.
I know, but that's what I'm saying. I would encourage you to watch it from the link, because it's got a lot of great stuff in there.
So we'll just talk about when you're doing grant applications, that's what I'm going to talk about, is what you need to include in a grant application. And you need to think about what the key aspects of involvement that you're going to have. And what most funders are looking for is what they call is a PPI plan. And that will be, what have you done before you put this application in? And what have you done since you put this up? What would you plan to do in the future? So that before you put it in, that could be things like choosing which outcome measures you're going to use. Very often, researchers will decide this is an important outcome from a study, but it's actually nothing that is meaningful to any person with lived experience. So it's important to talk about that with people with lived experience and decide what kind of outcome measures they would like. And then you also can ask them about the study design. For example, we had somebody who wanted to do a study on COPD, which involved going up to Queen Elizabeth Hospital, or Betty's as it's better known, twice a week to get bloods taken. Now, if you know anybody with COPD, it's quite difficult to get yourself going and get out the house. And to do that twice a week is a really big ask. So they were able to speak to people for the PPI group and just able to say, actually, if you do that, not many people are going to be able to take part in the studies. They changed the study design. So that all happened prior to the grant application. So you can write that into the grant application. You can say, basically, we met with the group on what occasion, who was in it, and then you go on to say, you know, we want to continue working with people with lived experience, and we are going to do this with however many, you could say a lot, you know, 2 or 3 meetings a year usually, and it could be looking at things like they will talk about the patient-facing documents, advising on recruitment. If recruitment isn't working, it's good to speak to lived experience group. And they can talk about, if you're doing qualitative work, they can talk about the interview topics. They can check the codings for interviews. They don't have to have a complete immersion in it, but they can check the coding in it. And also, they can also help make sense of any quantitative data that you're gathering. So, and then they can also advise on dissemination. So you would just maybe want to say that these are the activities that we're going to involve people in, and we'll do this over, you know, 3 or 4 meetings over the course of the study. And you also, it's good to say that there's a nominated person, in, especially NIHR, we'll be looking for, there's a nominated person who's part of your team that is going to be the named contact for your PPI group, because people in the PPI groups will need some support, and one of the simplest and easiest and biggest supports is to have a named person, so they're not constantly phoning up the research team going, oh, I actually was thinking about that questionnaire, who do I talk to, and they speak to a different person each time. That's not going to work, partly because it's confusing, but also partly because that relationship that you have with a person with lived experience is based on trust. And it's very important to be a constant in that. And that's how that trust is maintained. And that's how you get people who keep coming back to your PPI meetings. So you have a named contact, you can see that. And also, if you're applying through the University of Glasgow, I'm available as an NBLS central support for PPIE to help with things like training and documentation that you might need, how to pay people and things like that with payments. And also mention that you'll be paying people according to the NIHR involved standards. So to come further on that on payment, what are the expenses that you're looking at? Well, you obviously travel, people are coming in, though oftentimes people are just Zooming, but even there, it's NIHR like to see that's taken into account. So people are usually given, I think it's about £5 per meeting, and that basically covers any printing costs they may have, for any for their data, things like that. Not everybody can afford data. You might also, if people are coming in, you will also need to, you might need to pay for childcare or even for carers. We have somebody who comes to our Zoom meetings who is a carer for his mother. So he has to get somebody to come in so that he can fully concentrate on a Zoom meeting and not be called away halfway through. And some people have personal assistants if they have limited mobility. They maybe have somebody who comes along to help out as well, so you need to pay them. The whole idea of expenses is nobody is out of pocket. This is a big principle behind this. Nobody should be out of pocket. And there is ways of, through the University of Glasgow, doing an open check, so you can create cash, so you can reimburse people for the travel expenses. Obviously, different ways of doing that. You could set up a taxi account, which is really good, though not always entirely reliable, I've found in the past, but it works and nobody's out of pocket, and it's quite a nice way of, you know, you can pay people to come into a meeting. So there's a huge list of possible expenses, and you'll find that on the NIHR website, and that was shown earlier. So how to pay people for taking part in groups or participating in groups? Well, there's different ways of doing this. There's vouchers, and University of Glasgow has love to shop vouchers, and you can have that for Amazon, you can have that for Tesco's, you can have it for Asda, you can have it for Marks & Spencer's, and so on. And just ask people how they would like to be paid. Lots of people like to get vouchers because there's, I suppose, there's, if they're on benefits, if they get money going into their bank account, it might be an issue for them. However, if somebody is able to have bank transfer or backs, then you're into the wonderful land of the sundry payee form, and it is it's an experience. If anybody wants to do that, I'm happy to help with that. I would say that finance understands that people who take part in PPI groups are not employed. We have released a statement to that effect. And the key phrase to mention if you're filling in these forms is these people are participating in a PPI group. And participation, because that's similar to people participating in clinical trials. And you wouldn't be employing people to take part in a clinical trial. So that's the word there. Or another alternative is to do a fee, a donation, or a gift. Now, for some people who come from patient groups, they would rather the money goes back to the patient group. And somebody who works with Parkinson's in the Dundee Parkinson's patient group, he has the money goes, he doesn't take the money into his own account, it goes straight to the Parkinson's charity. And all you need is the bank code and the sort code, and you can do it that way. Another final option is the idea of affiliate status. If you have somebody who's a co-applicant, a lay co-applicant on a grant, affiliate status is quite good, because it means they can get access to the university, they get a university email, which means they can get access to the library, but also Teams, so they come and join you on team meetings, and that makes it a lot easier for people. If they are co-applicants, as co-applicants, they will be more involved in more regular meetings than the, you know, as a PPI group. They would usually be involved in the study management group meetings. That might be every 2 weeks, every month. I'm not sure, it depends on the study. So that's basically some ideas about how to budget for your PPI. So that should all go in there. And NIHR are expecting to see this. They're expecting to see the plan and they're the PPI plan, and they're expecting it to be costed on what their ballpark figure is 1% of the overall budget. So that's quite a lot, and we're not used to using it. So don't feel afraid for putting money in and as part of the PPI budget. I think that's all.
And then there's a couple of things.
Yeah,
Would that be
sure.
okay? So, as Tracy said, you know, if you have any things that you are not sure about when it comes to PPI, the very best people to ask are your PPI group and its members. So, for example, if you're not sure whether it would be better to have a meeting in person, over Zoom or Teams, or do a hybrid meeting, and you're kind of getting a little stressed about that, ask them, please. They are the experts in living with the condition or symptoms that you are exploring within your trial. So they're the people to ask, where things like coming to meetings, as Tracy says, or taking part in the trial, or giving you know, their expertise, whether they want to do that in person or via email. Just ask, always ask, and that's the best way to show you're being considerate, but it also recognizes and demonstrates respect for those experts, because they're the ones who can advise you on what the best ways to share information, to come to meetings, to take part, to be paid. And to give you just a very quick example of why how you pay people is really important, and again, why I would thoroughly encourage you to ask your members what their preference is that years ago, I was taking part in a trial as a participant. I had no money left. I was on benefits at the time. It was a Friday. I was getting my benefit check on the Monday. It's a check. This is quite a while ago. And I didn't have any food for the weekend. It was that simple. So I had the opportunity to take part in a University of Glasgow trial looking at psychosis. Went along, took part. It was an interview, lasted about an hour. Terrific, all good. The guy then handed me over 50 quid in HMV vouchers. This was a while ago. It was lovely, but entirely useless. As much as I wanted to, I can't eat CDs. So always being considerate of what it is your PPI group, you know, what their motivations for taking part. Just like your participants, what their motivations for taking part. It might just be they need money. And that's an entirely legitimate reason for taking part, either as a participant or as a PPI member. Your responsibility is to approach people who have a background that make them an informed person to have within your group. But if they're just taking part for the money, then that's fine. If they're taking part because they want to, as many surveys show them, that their driving motivation, both for participants and for PPI members to take part, is a sense of giving back, sense of helping others who are going through similar difficulties that they have. But that doesn't mean that money and payment doesn't help with that. And as Tracy said, paying and ensuring that people aren't out of pocket is important. At the Mental Health Network, we like to make sure that people are actually paid above, in amounts above what the NHS suggest. We want them to experience a meeting at home, say, in the same ways they would in the room with us, so that there's heating on, there's biscuits, there's coffee. They are covered for those things. They don't feel like they're second-class citizen if they're attending via a video call. There's lots of other things to cover here. I'm aware Tracy and I have basically scratched the surface. There is so much more to all of this. We can only fit so much in just now. I think the best thing to do now is to ask for questions. And also, Steph, if you wouldn't mind coming up and joining us. I think, Steph, you applying for your grant recently is possibly something that people might want to ask about. So I know it's always difficult asking questions. And again, oh, there is, brilliant. So, and again, you know, this is something with PPI members too. People might want to ask questions in a meeting or on chat or in an email afterwards, and always giving people those options is really important. Okay. Yeah, that was me. That was me. Okay. So yeah, that's Tracy's email there if everyone can see that. Sorry. So managing risk. How is personal liability insurance managed for PPI groups?
Gosh, that's
Wow.
a new one.
Yeah.
Well,
There's a couple of ways to answer.
Right, okay. Yeah.
Well, the way that I understand it is if your PPI member is simply coming along to take part in a paid by meeting basis. They're not employed by the university, so there is no personal liability insurance beyond any insurance that people being in the building are covered by. However, if they are doing work that requires a research passport and PVG clearance and all that comes with that, and that's another whole area to discuss at another time, they might then, I'm not 100% sure, but they might then also be covered by NHS liability insurance because they are being given permission to engage with patients in a way that NHS staff are. It's a great question and maybe something we need to think about a bit more actually going forward.
Yeah. Well, do stop sharing so we can see people?
Yeah, just do that. That's always a good thing. Is that all the chat stuff done?
Yeah, I think that's a good.
Great. Again, we're really not terrifying, I promise you. So please feel free to ask. Again, I've attached both Tracy's and my emails to every slide of mine. So if you feel more comfortable reaching out that way, then please do. I guess I'd be encouraging you to ask questions now because I can.
Yeah. There's another one. Is there a table diagram which lays out the difference between PPI, the community hub, and public engagement teams? Yeah, if you actually go to, we haven't done one, but that would be a good way of doing it. But NIHR have got a good definition of PPI, and they define involvement, they define engagement, and they also define participation. And I can add that to I don't know if I can do it to the chat right now, but if anybody wants to email me, I can send it on to them. I'm
adding something now, which I just sprang to mind actually when Tracy was speaking, which is NIHR actually have a PPI fee calculator on their website too, which again, I wouldn't encourage you to use to get a precise budget, but ballpark.
Yeah.
And also potentially as well to find within the broader site too, or you know, elsewhere as well. I'd encourage you to look elsewhere, not just NIHR, to come up with ideas about what might benefit and be useful and helpful in facilitating your own PPI group and its members with their demands that they might be facing. So let me just add that in. As Tracy kind of said earlier, NIHR stuff tends to be a basic level stuff, but you know, if you have a budget that can offer more, please do. Any other questions, anyone?
I think just if we just say the difference between involvement then and engagement. Involvement is where it's a bit more two-way. It's where people are involved in the actual design of a study. They are they advise on where to collect the data, how to collect the data, how to analyze the data, how to present the findings. Engagement is more about going out and presenting work that's going on. There is an overlap between the two, obviously, because if you want to present your findings from your study, you can involve people to help you decide what's the best way to represent that data or present it. I mean, what's the best? Should we use graphics? Should we use images? But then you can, if you want to go out and engage with the community, and you show them the findings. So that's engagement. So there is an overlap, and also engagement is things like conferences and going to community fairs and whatever. The community hub is, I think Susan Grants runs that, and that's an excellent source of all the community groups that are in and around Glasgow. Susan has done some excellent work on linking up with it. They will have heard about the research. Whether they know what involvement is, that's a different thing. And it's not for everybody. That's the other thing. If you're approaching some people, they may think, oh my goodness, no, really, I don't want to do that. But for some people it is, they really enjoy it.
Can I answer this one?
Yeah.
So, you know, always be upfront about the limits that you have when you're working on a study. As you know, I know I kind of mentioned that people might be involved just for cash reasons, but equally, people might just want to be involved to help as well. It's always just really important, as Tracy said, to generate trust, to show respect. It's just to be upfront. So if you don't have a PPI budget and you're still wanting PPI involvement, go and tell them that and ask them, would they be willing to do it? A lot of people will just say yes. So go ask. Again, always asking your PPI members or your potential PPI members how they feel about doing something for whatever amount of money, or you know, in whatever way is the way to go. And I know that can be challenging because we're all kind of taught to present this perfect researcher sort of veneer that we're meant to know everything about everything, and it can be quite challenging and counterintuitive to go along and say, here's what I have, do you want to take part? And I can't really offer you anything. But just ask. People are more often than not will say yes, if they feel your study is worthwhile.
Yeah, and Esther, that's a great way of doing public involvement for a PhD student. I maybe go back to your supervisor and say, have you got £100 that you could give me? I could put on a lunch or something like that for these people. But that's,
Got any other ones?
I wouldn't say it's any less robust at all.
No?
I think it's excellent.
The Piglets Vermont grant applicants spoke to the principal investigator and there was money which then could be put. I think it's sometimes, if I'm not sure, if it was a PhD student, it was a bit like a Victorian orphans, like that's gonna have support. So I think even just being confident about that, like just see what's available. Because sometimes there might be pots of money. But then as you have both said, that people may want to take part for like altruistic reasons, and sometimes people want to take part without being paid, and you kind of, and that's a bit of a discomfort for me because I want to pay people. But then I think I realise I'm prioritising my own views.
Exactly.
Discomfort, you're prioritising PPI and that.
That's why sometimes given to asking people, oh, is there a charity group that I can donate to works?
It's also just as a final point worth mentioning as well, that a purpose that taking part in PPI can serve people is if they are taking time off work, say due to a health condition, that's something they can put in their CV to fill that gap of employment, say, that might be there, and to show that they've been using their time purposefully, you know what I mean? Can't get the word out, but so there's lots of options there for how people might want to frame their PPI involvement and feel valued for it as well.
And it's also, if you say to Esther, if you could say to your supervisor that, you know, there's evidence to show that using the PPI groups to improve patient-facing materials has improved recruitment studies. So there's evidence out there to show that this is a good investment.
Absolutely, and that's a great point, which just reminds me, my last point is going to be around dissemination. There is such value in writing a clear, understandable, accessible lay summary of your results, because while we care so much about informed consent, informed information sharing is really important too, to help participants when, you know, if an intervention or medication, whatever, has been implemented in the NHS and they want to make, you know, they're being offered that, they want to make a decision about it. The only way that they're going to have information that isn't on a paywall, that isn't jargon filled, that is understandable, is if you can take the time to either write yourself or find someone skilled at it to write you a lay summary of the outcomes and the strengths, weaknesses, bonuses or dangers of whatever intervention or medication you might have tried. Okay, I think that is us. Thank you, everyone. Thank you for that. Was a great comment. And thank you for coming along. And for those of you who are watching this at a later date, you missed us live. But we are around, you'll see it around the building. It's great all being in the same place, nice. And thank you very much for coming along and giving up your lunchtime if you did. Much appreciated.
Thank you. No.